The following is a skit portraying a group of students having a class session with the instructor. They are discussing a scenario she encountered a few years ago and the clinical and theoretical aspect of it.
Everybody reach back from break?
Yes, ma'am.
Yeah, Miss. I
Yeah,
am.
miss.
All right, cool. What was talking about?
And we're talking about the theories, right?
Yes, we're talking about the theories. Right, so everybody did the assignment. So before we start, I will just get into the case scenario a little bit. So Jason, a 9-year-old boy, the son of 2 Venezuelan immigrants, is admitted to your unit after being diagnosed with lead poisoning. The child had been tough to control at home and very difficult to manage at school, as his parents reported. He was even reported to the school psychologist recently, as his mom admitted. He was the top 3 of his class since he started the primary school, but his grades have deteriorated in the last 5 months. He's even at risk of repeating the class after last month's exams. His parents also noted that his development seemed to have slowed down for the last 12 months. He was also bullied in school because of his ethnicity and his body. His mother described their family as a happy family, though they do not have a lot of means. They do live their dream in an affordable district house where the lead paint on the wall and woodwork had not been removed. Results of tests showed a hypochromic microcytic anemia on CBC count and high blood level of 22 mcg DL. And your assignments were to discuss the management of this patient, right? So in talking about the management of this patient, we're going to talk to the Gene Watson theory of human care, right? So Shariza, you're going to introduce us to the Gene Watson theory, right?
Yes, miss. So an overview on Jean Watson. This is her timeline. In 1940, she was born as Margaret Jean Hammond on the 10th of June in West Virginia, USA. She went to the West Virginia High School, where after she went to Roanoke, Virginia's Lewis Gale School of Nursing. In 1961, she graduated from that same nursing school, and later that year, she married to Douglas Watson, hence her name, Jean Watson. In 1964, she earned her bachelor's degree. In 1966, she earned her master's degree in psychiatric and mental health nursing. And in 1973, she earned a doctorate in educational psychology and counseling. Her accomplishments: she wrote many books, one of them being The Philosophy and Science of Caring, Revised Edition, which was published in 2008. She is the founding member of Watson Caring Science Institute in 2008, which was used to assist in the spread of her nursing theory and concepts. She was the president of the National League for Nursing and the Dean of Nursing at the University Health Sciences Center. She is a member of the American Academy of Nursing and a fellow of the organization. Watson has 6 honorary degrees, including an international honorary doctorate in 2003 from University of Montreal in Quebec, Canada, and an honorary doctorate of science in nursing from the University of Victoria in British Columbia, Canada in 2010. That's it, miss.
Okay, good job. So can you all see my screen?
Yes.
Everybody see it? Okay, right. So before we continue with the presentations, I just have a little video to show a little more about our theory, right? So I'll just make sure everybody could hear. Let's begin. has it. So, Stephanie, we ready for you?
This theory is relevant because it basically speaks of building a bond with patients and getting them to accept themselves. It helps them to express their feelings holistically, help strengthen or develop an interpersonal bond with themselves. I think that this theory fits into this scenario because Jason's ailment goes beyond physical illness, also including a state of emotional unwellness and dissatisfaction. This is supported by the information given about his behavior, specifically the fact that he is being bullied because of his cultural and physical differences. The decline in his academic performance also suggests that he is not focusing as much on school as he used to, also stemming from the challenges of being bullied. With the use of this theory, I believe that there would be better guidelines to be able to provide care, treatment, and betterment of not only Jason's lead poisoning, but also his emotional struggles.
All right, very good. So Sky, you will take over with the pathophysiology.
Okay. Okay, so lead poisoning can lead to microcytic anemia with basal stippling on the peripheral blood smear. Lead causes microcytic anemia because it inhibits ALA dihydrase and ferrochylase enzymes in the heme synthesized pathway. Hemoglobin is known to be a globular protein and is mainly made up of red blood cells created in the bone marrow by erythroid progenic cells. It is then grouped into 4 globin genes, 2 alpha globin, and 2 beta globin. These 4 chains then stick onto the peripheral ring heme. The middle of it contains ferrous ions, which is reduced ions, to bind onto oxygen molecules. When ferrous ions stop the manufacturing of the hemoglobin chains, it becomes less concentrated. This causes red blood cells not to be formed and it fades. That is why it's called hypochromic in its place. When the newly faded red blood cells are formed, they become smaller in size, called microcytic. A decrease of hemoglobin in the red blood cells can decrease the amount of oxygen being delivered to the peripheral tissues, which can cause hypoxia. Symptoms of this condition can be abdominal pain, irritability, constipation, lack of concentration, heat, and wrist drops.
All right, good job. So Glenn, we hand it over to you with the nursing management.
Okay, so I did 2 actuals and 2 potentials for, why is this not moving? Okay, right, so the actual diagnosis. The first one is imbalanced nutrition. The assessment for this patient: assess this patient for signs of lead poisoning, such as lethargy, irritability, pallor, and signs of shock. Assess the patient's breathing patterns and assess the patient for loss of appetite, nausea, and vomiting. The plan is after 16 hours of intervention, the patient will be able to tolerate well orally, develop an appetite, and reduce the feeling of nausea and urge for vomiting. The interventions are assess respirations, taking into note of SpO2 levels, signs of dyspnea, use of accessory muscles and positioning for breathing. Alleviate head of the bed for the patient to appropriate degree necessary to promote breathing. Encourage fluid intake at intervals of over 24-hour period of time and specify the amount of gradual increase of fluid. Administer medication as indicated. The rationale: ensure that SpO2 levels are monitored, helps to make adjustments to care if the patient breathing and pattern levels is not stabilized or normalized. A sitting position permits maximum lung excretion and chest expansion. Drinking small, frequent liquid-based meals lessens the feeling of fullness and decreases the stimulus to vomit, reduces nausea and vomiting. Evaluation: does the patient experience Relief of pain, does the client comply with medication, diet, and activity recommendations? Does the patient show any signs of nausea and vomiting? And does the patient have an increased appetite? The second one is acute pain related to lead poisoning. So we'll determine the location of the pain, determine when the pain started occurring, and determine what will aggravate or alleviate the pain. The plan is the patient uses suitable diversional activities and relaxation techniques. The patient describes the degree of pain management that is satisfactory, for example, less than 3 to 4 on the pain scale of 1 to 10. Patient's baseline pulse, blood pressure, respirations, and relaxed muscle tone or body postures all show signs of better well-being. Patient employs both pharmaceutical and non-pharmacological pain management techniques, and the patient mood and coping abilities have improved. Intervention: determine the location, duration, and intensity of pain using the pain scale from 1 to 10, and make note of non-verbal indicators, including high blood pressure or pulse, restlessness, groaning, and thrashing. Comfort measures should be implemented: back rubs, restful environment. Rationale: aids in determining the location of the pain and intensity of the pain, and relaxes the body's lower muscle tension and improves coping. Evaluation: is the patient experiencing less pain? Are the needed interventions put in place working for the patient? The potential diagnosis is knowledge deficiency of lead poisoning. So the assessment is determine who the learner is: the patient, a family member, a significant other, or a caregiver. Determine the patient's motivation and readiness to learn about the lithotripsy procedure. Determine the importance of learning requirements within the context of the overall care plan, and allow the patient to speak freely about prior experiences and health education. So the plan is ensuring that patient fully understands prognosis associated with lead poisoning, prepare patient with sufficient knowledge in order to decrease any reluctance of treatment. Interventions: consider what is important information about lead poisoning to be given to patient. Take note of how teaching and learning are progressing, encourage questions, and create an environment of respect, transparency, and trust and cooperation. The rationale: allowing the patient to choose the most important material to be provided first is the most successful method. Documentation enables new instructions to be based on what the patient has already done. Questions allow for free dialogue between patient and healthcare provider, as well as confirmation of knowledge of supplied information. Respect is especially crucial when educating patients who have diverse values and beliefs about health and sickness. Evaluations: does the patient understand the benefits of the pharmaceutical treatment? And that's it.
Okay, good job, everybody. So to end up today's class, from examination of this case scenario, it is evident that Jason is a good child who is just experiencing a difficult transition into his new environment as a result of being in Venezuela. In addition to this, the lead paint at his home caused him to contract the lead poisoning. Now, the lead poisoning diagnosis can be managed as Calencia just stated. However, we could use Jean Watson's theory of human care to address the other issues and the rest of Jason's management, right? So her theory encourages optimal care as an individual, which goes beyond physical wellness. So this theory enables care provision, which ushers and supports Jason becoming mentally healthy through self-actualization. By getting Jason to a point where he is comfortable, proud, and sure of himself and his self-worth, we can generate behavioral improvement as the bullying he endures would no longer be effective. Then this behavioral improvement will then regurgitate good academic performance, further increasing self-actualization and creating holistic health, sorry. And this is how we can apply Jean Watson's theory of nursing, theory of human care, sorry, to nursing and to the specific case scenario. All right, you all understood? Everybody got everything that was done? All right.
Yeah, miss.
Okay. So I guess that's it for today. Y'all could leave. Don't forget, y'all have exam tomorrow, opening at 9 and closing at 12, okay?
Yeah, miss. Oh.
All
Yeah, bye,
right.
miss. We have our next class.
All
We have
right,
our next
bye.
class. Bye.
follow me.